welcome everybody to Plant-Based Kidney Health. We are on episode 8. This is going to be a continuation from where we left off, which was our talk about high blood pressure and kidney disease. So this is going to be a part 2. Don't forget, you can check out part 1 of this podcast episode in there on all the podcasts as well as on YouTube going on. So Michele, so glad to see you again.
You too.
How are things?
Good. Everything's good. I was very happy that Bruce, my dog, that he did not interrupt us on the last episode recording. I even saw someone drop something off on the front porch and he didn't bark. So I'm hoping he doesn't interrupt us this session either.
Well, I think that's so cool that you have a dog. My daughter keeps wanting, my little one, the 4-year-old Celine. Celine wants a dog so badly. So I told her, I said, listen, if you get a dog, you got to walk the dog. You got to clean after the dog. That part they don't want to do. They say, well, Daddy, that's your job.
Yeah, they just want to play with the dog and you get to pick up the poop and feed
That's
it.
That's right. That's right. So we're still in negotiations and discussions. My wife hates cats. So she said, absolutely no cats. But my older daughter is obsessed with cats. And I'm not really into cats. I don't dislike him or like him. So I don't know where she gets that part of the genes from.
Well, it sounds like once they negotiate well enough, you'll be getting a dog then.
Oh my God. I'm such a softie and pushover, man. They get away with everything with me. It's really hard. Like I every time I do that, they give me like this real puppy dog face. And then next thing you know, I end up saying yes. So I need lessons from everybody listening and watching on how to be more like, tougher with my All right. So, Michele, let's see. One question we had from last time that we didn't get to was, when we are looking for sodium on the food label, because, salt and sodium is starting to get hidden a little bit and people get confused on this topic a lot. And then a second part to that I really want to know about is what would you say are some really common high sodium foods that people really ought to think about?
Yeah. So first of all, when looking at a food label, number one thing is don't go based off the claim being made on the front. You really want to investigate the label and ideally the ingredient list. If something is making a claim, it can be very confusing. Like it might say reduced sodium, but that doesn't mean it's low in sodium. And so that's where it can get confusing because there's no salt added claim. There's reduced sodium. There's low sodium. And so it can get really confusing. It's better if you just know some kind of quick guidelines to, when you are looking at the label. So one of the easiest things in general is that when you look at a food label, there's something called the percent daily value, or you would see it as percent DV. And if you look at that, for something to be low in a nutrient, then it would be about 5% or less. So if you were looking at the label and you go to how many milligrams of sodium, and if it says 4%, 5%, 3%, anything less than 5%, then that's going to be roughly, it's going to be low in sodium. Anything that's 15 to 20% of the daily value or higher is going to be high in sodium or high in whatever nutrient that, it's listed for. Where we can get so technically within those terms, in order for something to say low sodium, then it has to be 140 milligrams of sodium or less. Like that's per the, FDA labeling laws. So a good example of this is if you are looking at those store-bought, like veggie broths or soup broths, and normally like a regular sodium one, it can be around 700 milligrams of sodium per cup. And then you might see, this one says reduced sodium. That typically means the sodium has to be reduced about 30% from the original amount. So it could still be high in sodium. And then low sodium is going to have to be like a low sodium vegetable broth has to be 140 milligrams of sodium or less per serving. So you can look for that 140 milligram number. You can look at the 5% daily value. So just keep that in mind. And then of course it comes down to that's on a per serving basis. So the portion can add up depending on how much of it you're consuming. I think soy sauce is a really good example for this. Regular soy sauce can be 700 to 900 milligrams of sodium per serving, which is usually about a tablespoon. Reduced sodium is going to be lower, but but it still is high in sodium. And especially if you're using multiple servings, that's where it really starts to add up. So that's really what you're looking for on the label. The other thing you want to be mindful of is a lot of low sodium or no salt added or reduced sodium products will use potassium chloride instead of sodium chloride. And you have to look on the ingredient list to see if potassium chloride has been added. So a lot of these like lower sodium canned soups will then have potassium chloride, which typically we want to avoid. We'd rather you get potassium from your, whole plant foods, fruits and veggies than be getting it in this, it being added to a processed food. And then that brings us into your question, or just what are the most common high sodium foods? So aside from just restaurant food and fast food, which is pretty much almost always very, very high in sodium. But again, canned soups can be very high in sodium. Surprisingly, breads and tortillas and things like that can have a lot of salt added. So you're going to want to check the label for that and look for a low sodium option. And other things can be like pre-made dishes. So like a frozen meal, pre-made anything can be very, very salty. Of course, snack type food, junk food are chips and pretzels and stuff. It's really, I was talking to someone about this the other day, and it's just shocking how much salt can be added to products. And it could be such a great, like, okay, well, this seems, I read the ingredients and it doesn't have, a bunch of junk added to it. It's just the actual food, but then they added so much salt to it. So really anything with a label, you want to turn it over, look at the milligrams of sodium, and ideally then take a look at that ingredient list, make sure that there's no potassium chloride added to it. And, you can for a lot of things, you can make, another common one is those the pre-cooked rice blends. So if you make brown rice or wild rice or farro or something like that, you can make that low sodium yourself, making it at home. But if you buy those microwavable ones and they have salt added to it, sometimes that could be, 300, 400 milligrams of sodium per serving, versus if you just made it yourself at home, even if you used a low sodium vegetable broth to make it taste better and you added some seasoning, it's still going to be a lot less sodium than that.
And I would just add that as everybody listening and watching this is thinking about this, just remember, just because they say, a few hundred milligrams in one serving, but what you really eat is like 10 servings, you have to think about what you're going to eat. So don't let the serving size fool you, because some of the manufacturers, and we've seen this in a lot of other products as well, not just in the sodium era, in the sugar era, and the fat era going on, where they make all sorts of claims, but when you look at the serving size, they can very easily manipulate what the label ends up saying. So please think about what you're going to eat. Lay's has that slogan, and please, Lay's, I mean no offense whatsoever, but Lay's has that slogan which says you can't just eat one. Well, yeah, you can't just eat one. So when you look at that serving size, and I don't know what the serving size on the bag of chips is, but if it says like 5 chips, listen, most people are eating like a lot. And so then when you think about the salt you're getting, that's quite a bit.
Yeah. And especially with the chips and those snack type of foods, that's where the servings add up really quickly, because it can be anywhere from 9 to like 15 chips, depending. But if you are just eating straight out of the bag and you're dipping in, a sauce or something that also is a few hundred milligrams of sodium, well, now your couple hundred milligrams per serving has become 800, 900 milligrams of sodium. And the other one that is super misleading, that's a good example, is those, the top ramen packets. And if you look at the ingredient list, it's still crazy high in sodium. It's like 800 milligrams or something per serving, but then it says the serving is half of a packet of noodles and half of a seasoning packet. And it's like, okay, it's already a pretty small serving, and you're only supposed to then have half of it. And so that's where it can be really misleading, is if the manufacturer is trying to make it seem like it's less sodium, so now they've just reduced the portion size so that maybe they can make a claim on the front that says it's lower in sodium. So unfortunately, we are up against, big food companies and marketing, and they want us to buy and eat more of their junk food. So just, check out the label, be mindful, do the math and see, okay, what am I actually going to consume? And then if it's really high in sodium, then ideally pick a different product. Okay, so I have the next question for you, and it's kind of a multi-part question, but what is the optimal blood pressure range? And this person said that they get different recommendations from their nephrologist, their cardiologist, and some of their different doctors tell them different ranges for what their blood pressure should be or what they should be aiming for. So what's the truth on that?
Yeah, so first thing is that your cardiologist and nephrologist are not giving you different answers. This is really important. It's like when my parents go to the doctor's office and they come back home and I say, Mom, Dad, so what did the doctor say? Oh, we're doing great. And then, most of the time I know the doctor, so they'll call me up and they'll say, well, we talked about this, and we said, if you do this, then this applies. So here's where all of this stuff starts to matter. Some people can have certain issues with them where they may need to run a little bit higher. For example, there are people who, when they're sitting down, their blood pressures may be normal or higher. But when they stand up, it drops so much that we call that orthostatic hypotension, that they may pass out and fall down. So then you may have their heart doctor saying, look, Mrs. Jones, we need to keep your sitting blood pressure higher because when you try to stand up, it drops so much that we get very, very concerned. So there's all of these things that are nuances that go on. So let's talk about the general recommendation that's followed by both nephrologists and cardiologists that you need to understand. So as of 2017, the American College of Cardiology, the American Heart Association guidelines are very clear. Now, these are much stricter than what we used to say back in the day. So remember, back in the day was that if you were less than 140/90, you were okay. And in some places, they used to say less than 150. Those days are gone. We have more data. So what's normal is less than 120/80. Period. That's considered normal. If you're more than that, meaning your systolic, which is the top number, is 120 to 129, and your bottom number, diastolic, is still less than 80, that's still elevated. That's still on the higher side. If you're stage 1 high blood pressure, your systolic top number is 130 to 139, and your bottom number is more than 80, meaning 80 to 89. Stage 2 is really if your blood pressure is over 140 and your lower number, diastolic, is over 90. So, very simply, if you're less than 120/80, you're on the normal side. If you're higher, we need to take action to make sure that we correct it. So don't let the confusion occur. And, people will simplify things saying that one doctor said this, one doctor said that. That's not the case. The one doctor might have said it because there's a very special reason why in your specific case, we are concerned about X, Y, and Z, and that's why we're saying that. But for the general population, this is what it is. But that's why even on this show and this podcast, we tell you, you have to see your personal dietitian. You have to see your personal nephrologist or cardiologist or primary care doctor because you are unique and you have to know that.
Yep. So how do we, if they are falling in that range of elevated blood pressure, whether it's slightly or it's actually hypertension, how do they control that and how do they lower that?
Yeah, so there's two ways to do it. One is through sort of the pharmacology side, and one is through the non-pharmacology side. So for people who have kidney disease, for example, we have lots of choices of medications. The primary ones that we use, remember, in kidney disease, there's this activation of the renin, angiotensin, aldosterone system, or RAS. RAS is something that will lead to vasoconstriction of your blood vessels. It's doing the opposite of what you want. It's actually reducing the blood flow to the kidneys going on. So we need an angiotensin inhibitor. So one class of drugs is ACE inhibitors, an angiotensin converting enzyme inhibitors. Another one is an angiotensin receptor blocker. So we're still targeting the RAS. And then another one is an aldosterone receptor antagonist. Fancy names that basically say we look at the RAS pathway and we block at different places along with it. Now, in general, ACE inhibitors versus ARBs. ARBs are generally well tolerated. They do exactly the same in terms of efficacy, but ARBs are well tolerated, more so because they have less side effects than ACE inhibitors do. That's it. That's the only difference. So when it comes to medications, which one do we pick for you? It depends on where you're at. For example, if you're somebody that despite seeing, Michelle or your own dietitian, your potassium runs high, then maybe you're not somebody that I'm going to start you off on an ACE. Maybe I'm going to start on something that doesn't cause high potassium. So a calcium channel blocker or even a diuretic to start off with. So this is where individualizing, and once again, it's the practice or the art of medicine is so important to know you are unique and there's only one of you. And so we have to make sure that our treatment is tailored towards you. So that's the medication side. Now let's get into the people who are not ready for medication or who need medication, but what else can they do? So first thing is a low sodium diet. Does it help? The answer is yes. According to research, you can lower your blood pressure, the systolic, the top number by about 5 points and the bottom number by about 2.5 points if you stick to less than 2.3 grams or 2,300 milligrams of sodium intake per day. The other one is that makes a difference is a diet that's similar to DASH or a diet that's rich in potassium. Now, hear me out. Remember, we've talked about in kidney disease, if your potassium is high, high potassium will kill you. It will stop the heart. It will cause an arrhythmia and so forth. So if you don't have a contraindication to high potassium, then we can actually make you have foods that are rich in potassium. And by eating those foods, you will actually see that your blood pressure goes down. A simple thing is if you drink alcohol, cut it down, right? How much to cut it down? The more, the better. If you've seen some of the previous data that I've presented, there's actually no safe drinking limit when it comes to brain health. So yes, we all enjoy a glass of wine here and there, but that's what it is. It's here and there. So if you're thinking about it, you definitely want to cut it down. And remember, the United States has the loosest guidelines on what is safe alcohol consumption. That whole thing of 1 or 2 drinks a day, in my opinion, is ludicrous. It doesn't support what the research shows. It supports what the makers of, alcohol companies want you to do. Other things that are really beneficial is a diet that's rich in magnesium, and we give magnesium supplements. If, for example, when women are pregnant and they have something called preeclampsia and their blood pressures are really high, we'll actually give them magnesium. But magnesium foods and magnesium supplements are linked to lower blood pressure. The other thing that matters is, and the reason why Michelle and I are such big proponents of a whole food, not just a plant-based diet, but a whole food plant-based diet, is because eating a high fiber diet, which is plants, right, which is fruits, vegetables, legumes, all that good stuff, what it shows is that just by increasing fiber and going up by about 10 grams a day of fiber can lower your blood pressure by 1 to 2 points. That's the top number, and 1 to 2 points on the bottom number. Now, 1 to 2 points is not anything to go home and party about and have a glass of alcohol to undo it. But here's the thing. So far, we've mentioned low salt, high potassium, as long as you don't have a contraindication, cut down your alcohol, up your magnesium, up your fiber, and then if you replace your carbohydrates with soy protein, meaning that when you look at your total intake, and remember for kidney disease, we are recommending lower amounts of protein, preferably more plant-based, right? So 0.6 to 0.8. If you think about it and you get about 40 grams a day of soy protein and you're replacing some of your processed carbohydrates with soy, what the data shows is in a study, after about 12 weeks, you could lower your systolic blood pressure by about 4 points. So increasing soy protein, tofu, all that good stuff in your diet can give you another 4 points going on. Folate or diets rich in folate and folate supplements can lower your blood pressure by about 5 points. But I wanted to save the best for last, which is cocoa and cacao. So when you look at the data on cocoa, what it shows is that people who consume it on a regular basis, you get about 2 points reduction in your blood pressure. Why do I prefer cacao? Because cacao has much less processing than cocoa does. So therefore, it's better. It also is higher in what? It's higher in fiber and it's higher in magnesium. 2 things that we just mentioned are going to be important. So we talked about the medication route, but there's all of these things on the food and supplement route that you can also do that are shown to be helpful. They're not magical. And it's not like you're going to do just one thing and it's going to fix your blood pressure. You're going to do as many of these as possible. And then, of course, it's lifestyle, it's exercise, it's sleep, and it's stress, and so forth.
Yep. And the thing too with that's important. And like you said, all these different things will decrease a little bit, but when you combine them all together, it ends up being a pretty significant decrease in blood pressure. And you had mentioned the DASH diet. And I think it's really, oftentimes we think of that DASH diet or the dietary approaches to stop hypertension, and sodium and low sodium diet's a big part of that, but it's also about all of these beneficial foods that you are adding to your diet, and the fruits and vegetables and nuts and seeds and legumes, and again, whole grains over processed grains, and soy protein or other plant protein, especially too over the animal protein or refined carbs. It's all of these things that you're adding to your diet in combination with the lower sodium diet, in combination with being physically active, that really you'll see the optimal benefits of helping lower blood pressure.
Yeah, absolutely. So as people, one of the things that we've started to notice recently is a lot of people have heard the term plant-based. There's plant-based burgers now. There's plant-based imitation chicken nuggets. There's plant-based, I don't know, you name it, plant-based sausages now. So what are some mistakes that you would say, and this is something that I think is really important because people are totally missing the mark on marketing, on hype versus hope. So what are some common mistakes that people make when it comes to, being mindful of things like sodium as they transition to a plant-based diet?
So the biggest mistake that I find people make is that they rely on these processed plant-based or processed vegan foods. So there's maybe saying, okay, instead of eating a burger, I'm going to do a vegan burger, a plant-based burger. But what they don't realize is that it's oftentimes still loaded full of sodium. They can sometimes still be high in saturated fat, depending, what types of oils added to it. But really the sodium is a huge thing there. And so the benefit of a plant-based diet is really in the whole food aspect of it. And so if you normally eat out and you get, like a chicken, or let's say like beef and broccoli, right? You're out at a Chinese restaurant and you're doing beef and broccoli with rice. Well, if you make that meal at home and you do the broccoli and you do brown rice instead of white rice, and then you do black beans, let's say, instead of the beef, or you do some tofu, and you are not dousing it in, 2,000, 3,000 milligrams of sodium from the sauce alone, that's where you see the true benefit, not in a store-bought vegan beef pre-marinated mix. And so that's usually where the biggest mistake is there. It's those vegan meats, those vegan, just highly processed vegan or plant-based foods that are full of sodium. The other thing too, I would say, is when people are eating out a lot, and, there's a lot more restaurants that will have vegan or plant-based options or vegetarian options. But again, it might be made with a processed vegan meat, or it might just be really crazy high in sodium. And then the other place is just processed packaged foods that are labeled plant-based. And, you could have cookies that are plant-based. It doesn't necessarily mean that they're healthy. You could have chips. I've seen, it's that term plant-based is really starting to be used on a lot of things. It's like plant-based popcorn and plant-based tortilla chips. And it doesn't change the fact that it was before and it is now still a highly processed food. And again, it doesn't mean never can you ever touch that, but we don't want that to be the bulk majority, 80, 90% of what you're consuming in your diet. We want that to be the fruits, vegetables, whole grains, legumes, nuts, and seeds that you're cooking and preparing ideally at home and are not highly processed. And then the other thing too, I would say, is like dressings and condiments can add up pretty quickly too, as far as the sodium goes. So just, again, you can always find lower sodium options or make your own at home. But that is something you want to be mindful of, is whether you prepare it at home or out, you make this great salad or bowl or this meal, and then you put, I don't want to call out any specific restaurant, but I've seen from their nutrition information online where like the salad dressing is 1,000 milligrams of sodium. So you're like doing great. You're having all these veggies and then you put 1,000 milligrams of sodium of dressing worth on the salad. And so that's kind of a common pitfall that I see people make just in the going more to a plant-based diet.
Oh, that's excellent. And you know, there's a restaurant that I absolutely love, and they have this tofu and veggie burrito that I love. And everything in there is, you know, it's really healthy for you, except for this one burrito has more than 1,000 milligrams of sodium. It's crazy.
Half of that is probably in the tortilla. Like I've seen some places where the tortilla, I mean, granted, usually it's like the big burrito sized tortilla, but those could be 600 milligrams of sodium just for the tortilla. And it doesn't leave much room for you to then have some sort of like hot sauce or, you know, condiment or something on it when the tortilla itself is like an entire meal's worth of sodium.
Yeah. What to do.
I know. Okay. So I have the next question for you. And you know, I think this comes from someone who's probably very, you know, frustrated, but they said, you know, is it possible for someone who's following a whole food plant-based diet, they have low stress levels, they're exercising, they're taking their blood pressure meds as prescribed, and they still have high blood pressure? And one, is that possible, I guess, to be doing everything right and to still have high blood pressure? And if so, what else can someone do?
Yeah. So, you know, it's interesting. In 95% of the people who have high blood pressure, you know, we don't actually know why they have it. So when we call it like idiopathic, or we come up with some medical term that sounds really fancy, it's just our way of saying is we don't know why you have it. So you got to know that. So in other words, good people get diseases, good people can get cancer, good people can get heart disease, and we still don't have all the answers. So don't be frustrated by it. But there are certain things that do become important. For example, there are certain conditions that cause high blood pressure. There's something known as renal vascular disease or renal artery stenosis, where the blood vessel that goes and supplies the blood to your kidneys is narrowed. And, you know, it used to be in medical school, they would try to tell us, oh, go listen to the belly and see if you can hear an abdominal bruit. I can tell you, I've seen lots of patients who have renal artery stenosis. I've never heard it. But, you know, we have lots of imaging studies that we can do, and so we can tell that. One of the hallmark features is they can also get recurrent fluid buildups in their lungs. We call that flash pulmonary edema. So that's one thing. There's lots of drugs that can cause high blood pressure. Most common ones are, of course, things like birth control pills. Birth control pills cause high blood pressure. In men, especially in teenagers and young adults, anabolic steroids are known to cause high blood pressure. Your common NSAIDs, Motrin, ibuprofen, Aleve, etc., and all those things. NSAIDs, which are non-steroidal anti-inflammatory drugs, they can raise your blood pressure. If, God forbid, somebody's getting chemotherapy, certain chemotherapy like tyrosine kinase inhibitors, those can cause high blood pressure as well. So those are some of the things. There are other classes of drugs. For example, calcineurin inhibitors, which is a class of drugs we use in transplant patients. There are antidepressants that can do it, so you want to know about that. There's a type of tumor that's called a pheochromocytoma, where there's sweating and palpitations and headaches, and people have these really high blood pressures. That's just because of the tumor. You find the tumor, you take it out of their body, that's gone. People who have excess weights, who have smaller necks, who have something called sleep apnea. And that's basically where your partner or your loved one says, hey, you know, you snore really loud at night, but there are periods where you stop breathing. So you snore, you stop breathing, and then you take a big breath in to start. That's sleep apnea, and that's linked with high blood pressure. And the only treatment is to get rid of the sleep apnea. If you do that, the blood pressure actually goes down. There's narrowing of the aorta, right, as it comes off the heart. We call it coarctation of the aorta going on. Hypo or low thyroid levels are linked with hypertension going on. And then a gland behind the thyroid called the parathyroid is also linked when it's hyperactive, or we call that hyperparathyroid. So there's so many conditions that are linked to it that you want to know about. But the bottom line there is if you have it, and even if we can't figure it out, it's not because you did something wrong. Sometimes bad things can happen to good people. And if that's the case, we just need to make sure that we do the best we can to stack the deck of cards, the odds in your favor.
And is it something to where, like, potentially they, might need a medication adjustment, but is it possible that they would need, you mentioned all the different types of medications that we use in kidney disease to help treat high blood pressure, that maybe they just need to be on a different type of one and a different dose? And so, because I've seen sometimes people have been on their medication for like a year and blood pressure is elevated and they've done all these things, and maybe, I guess, they just need that medication to try something different.
Yeah. So, a lot of times I get patients coming to me for second opinions, and they'll be on 4, 5, 6 blood pressure medications. And they're like, "Doc, none of these medications work and they're not controlling my blood pressure." And usually the patient is right. And what we do is one medication at a time, very safely, we titrate it off and we see, does the blood pressure stay the same or does it rise? If it stays the same, that medication wasn't doing anything. Mm-hmm. So what we try to do is we try to attack blood pressure from different angles. So look at different mechanisms of drugs, use lower doses, and try to combine them rather than just take one dose all the way to the maximum. And even though patients don't like it because they're like, "I don't want to take 2 or 3 drugs," but I can get you safer, better results by using 2 or 3 drugs at a lower dose than using one drug at a maximal dose. That's the first thing you want to know. Number 2 is when it comes to the variety of medications and everything we have, even if you've been on a drug for 5, 10 years, you can still develop some of the side effects all of a sudden. So just because you've been on it, it can stop working, number 1. You can be resistant to it, or you can even have side effects from it. So as a result of it, working with your doctor becomes very important so we can individualize and safely. The last thing you want to do is stop your medications on your own. Why? It's not because, "Oh my God, we want to control the medications." It's because you don't want to have a rebound where your blood pressure is controlled, it shoots up, and God forbid you have a stroke or a heart attack. And that was something that could have been avoided. So anytime you're frustrated, see your doctor. If that's not working, get a different doctor. Get a second opinion. Do that, but find a physician and a physician care team that's going to be your partner in health. That's not going to be a one-way top-down approach, but it's your partner. So we figure out, we talk, and we find out what are your goals and values, and how can we align that so that you have quality of life with it.
Yep, that's so important. And that, again, just another reminder that we talked about in part 1 of, high blood pressure and kidney disease was, knowledge is power, and being proactive and checking your blood pressure and having that data to bring to your doctor so that they can, adjust your meds or try different things and work with you versus, again, if you just check your blood pressure when you go into the doctor and they have that one point, it's a lot harder for them to work together with you because they don't have all the data that, you could have or should have been keeping at home. So.
Agreed. All right. Well, I think we are up on time. So thank you guys so much for checking out this episode. We really appreciate you guys' support. As always, Michele and I would be so appreciative if you guys can, share this with your friends, tell your friends about it. If you haven't left us a review on iTunes, Apple Podcasts, or any of the podcasts, we'd really appreciate it because that's how we're able to get this word across, to be able to deliver to you evidence-based information. This is not just stuff that we make up, but we have studies that we read all the time to be able to come here and show you guys and teach you guys how to be able to live a little bit better.
Yep. And again, you guys can submit your questions to plantbasedkidneyhealth@gmail.com and we will keep addressing them. Again, you guys have been submitting great questions and so many that we have to do multiple episodes about, and then there's follow-up questions to it. So we love what you guys are submitting, and we're happy to answer them. And, stay tuned for our future episodes.
Fantastic. Thanks so much, guys. We'll see you next time.
Bye, guys.